Hi, my name is Umesh Khot from the Cleveland Clinic, and I'm with Emily O'Brien from Duke University. We're the chair and vice chair of the Q-Core meeting at Scientific Sessions this year. And we have a very exciting program through a number of different areas, and we'd like to highlight some of those here. I'm going to start by turning it over to Emily to touch base in terms of one of our important sessions. Go ahead, Emily.
Thanks, Umesh. So one of the sessions that I'm most excited about this year is our session on global cardiovascular outcomes. We have 4 phenomenal presenters who are lined up to give us this global perspective on the important work that we do in cardiovascular outcomes. We've really designed this session to prioritize topics that will be of interest, not just for people who work primarily in global health, but for the broader Q-Core community. We're starting with this premise that there's not just a need, but really an urgent need to establish and organize a global community of cardiovascular quality and outcomes researchers. And we have some concrete examples of how this might be done and how such a community can leverage both observational data and randomized data to optimize quality and outcomes. We'll also be highlighting several of the informatics challenges that are really front and center when trying to harmonize data across countries, and future directions for thinking about how to integrate those data to support evidence-based practice globally. So I think this is going to be a wonderful session. I'm really looking forward to the insights that we'll be hearing from our presenters and moderators.
Great, thanks so much, Emily. I'm going to talk now about one of our very important sessions we have every year, which is the Early Career Investigator program. And we really try to highlight the best science. And one of the interesting things that we have here is that the type of programs we have here are so broad in terms of the reach, and so we're covering a huge number of areas. Just highlighting a few of them, we have a study looking at how SGLT2 inhibitors are being prescribed in Medicare populations. We also have another study looking at how LVAD utilization happens in narrow networks to see if there's an impact in utilization when that happens. We also have one looking at the role of frailty in TAVR. And then a fourth one looking at best practices for in-hospital cardiac arrest. And the last one is looking at how neighborhood deprivation, what impact it has in a large STEMI system of care, and whether that can change the outcomes of patients who live in lower area deprivation areas. And so I think the interesting thing here is that we have such a broad focus through a number of different areas, but ultimately all of these have important impacts on the quality of care and outcomes for our patients. I'll turn you over to Emily for the third session on mHealth. Go ahead, Emily.
Thanks, Umesh. So our mHealth session is really going to be an interesting session this year. We're focusing on this question of where is mHealth today? So certainly this is a fast evolving space, lots of new technologies, lots of hype, but really getting down to what are the success stories and what can we do to leverage the lessons learned from those stories to improve cardiovascular quality and outcomes. So we're focusing both on broad considerations about things like mobile phone data analysis. So what do you do when you have such a large data set? What are the ways to really get at the key insights that come from that source? And also how mHealth can bridge the so-called digital divide between people across various levels of socioeconomic status, geography, et cetera, and make sure that cardiovascular quality is evenly distributed regardless of access. We also have a few specific examples to really get us thinking about how to empower patients to be in the driver's seat of their own cardiovascular health through this structure and through the mechanisms that are offered by mobile technologies. So I think it's going to really showcase a lot of the innovative approaches to cardiovascular quality and outcomes research.
Great, thanks. I think that's one of the big things that we want to try to do is to take mHealth, which is very innovative, but bring it understanding some structure and showing how it can actually be measured in terms of improvements in outcomes and other important areas. The fourth topic I want to talk about, obviously, we're still in the COVID pandemic, and that really has led to a lot of changes in terms of how care is being delivered. And so we have a session on quality of care and outcomes during the COVID pandemic with a number of different programs. One of which was something we're facing every day, which is the impact of COVID on the workforce. Most institutions across the country are having serious problems with getting nurses and even physicians, respiratory therapists. So we have a session looking on that. We also have the fact that, data is increasingly important and being able to share that data across institutions and across the country. So we have a program on democratizing availability of data during the pandemic. And then the other thing in terms of COVID is going to likely change things permanently. So we have a session on long-term structural changes to the care delivery. And we have a second session on long-term structural changes to cardiovascular research. I think the pandemic is going to really change things in a way that we may have some ideas about it, but the full extent of it, we don't know yet. And so this is an opportunity to investigate that. The last thing at the end of the program, we have highlights. We'll be showcasing our early career investigator finalist winner. We're also going to have a Lifetime Achievement Award given to Dr. Fred Masudi for his contributions in this space, which have been quite considerable. And we'll end the programming with a networking session where we'll connect with a lot of our colleagues across the country and the world that we would normally do in person, but we're going to try to do it virtually and make sure we have a good personal connection from that. So I think that we're very excited about all of the different things that we can offer here in terms of this program, and we look forward to your participation and engagement. So thank you very much.